Hello everyone, my name is Ferdousi Rawnaque. I'm a third year PhD student at Penn State University. Today I'll be talking about the effects of elastic modulus and impurities on the distribution of bubble nuclei available for acoustic cavitation in polyacrylamide hydrogels. Cavitation is described as the phenomenon where pre-existing bubbles in a medium either oscillate or grow and collapse under varying acoustic pressure field. In biomedical ultrasound, acoustic cavitation is either leveraged or avoided depending on the desired outcome. Where cavitation is harnessed in therapeutic ultrasound to create beneficial bioeffects such as tumor ablation, breaking down blood clots, or delivering drugs to a specific target, as shown in the image, diagnostic ultrasound avoids any kind of cavitation that can cause unwanted tissue damage. Although there is always a likelihood of cavitation occurring during ultrasound application, bubble nuclei available for cavitation in biological tissues remain comparatively unexplored than water. Water being a simple medium, several models have been proposed and accepted which justify the pre-existence of bubble nuclei in water. However, having cellular and extracellular components of different size and physical and chemical properties makes such models much more complicated for biological tissues. Yet, understanding what effects bubble nuclei that can source cavitation in tissues is essential for clinical safety and efficacy of ultrasound. So in this study, we addressed two primary questions. First, how does elastic modulus affect bubble distribution available for cavitation? And second, how do impurities that are commonly found in tissues affect cavitation threshold? To initiate our investigation, we used polyacrylamide, a common tissue mimicking phantom, as our medium of acoustic cavitation. Polyacrylamide has acoustic properties similar that of soft tissues, and it being physically transparent gives us the opportunity to visualize cavitation activities through high-speed photography. Moreover, the stiffness property of this gel can be changed by controlling the acrylamide concentration in the gel solution. For our study, we have used three different polyacrylamide concentrations to fabricate increasing level of elastic modulus as shown in this plot. Using these three elastic moduli gels, we try to explore how does changing elastic modulus affect bubble nuclei available for cavitation. To investigate how hydrophobicity and size of impurities affect cavitation threshold, we have added three types of impurities in separate polyacrylamide hydrogels, such as hydrophobic cholesterol crystals, which are commonly found in arterial plaque, which had a maximum dimension of 0.6 millimeter. Then a less hydrophobic crystal, calcium phosphate, which are commonly found in joint fluids, and calcium phosphate is a primary reason behind arthritis. And in this experiment, this had a maximum dimension of 0.4 millimeter. And finally, bovine serum albumin, which is a common blood or plasma protein. And in this experiment, we used bovine serum albumin at two different concentrations, and these had an average dimension of 140 angstrom. Adding these impurities in polyacrylamide gels introduces inhomogeneity similar to biological tissues. And with that, we observed if hydrophobicity and size of these added impurities affect cavitation threshold, where cavitation threshold were defined as peak negative pressure at which cavitation occurs 50% of the time. To observe these effects, polyacrylamide hydrogels were submerged in deionized and degassed water and were aligned with HIFU transducer focus as shown in this cartoon diagram as our experimental setup. A 1.5 megahertz HIFU transducer was used to induce acoustic cavitation in polyacrylamide hydrogels using 10 millisecond pulses with peak negative pressures ranging up to 31 megapascals at 1% Urey cycle. Spatial distribution of the initial bubble nuclei were monitored through high-speed photography at 40,000 frames per second. For the elastic modulus study, once high-speed photography of the cavitation events were captured, consistency of bubble formation sites were analyzed at 75 microseconds using bubble area overlap measurement. First, captured grayscale images were binarized in MATLAB, and then images of three exposed spots to the same peak negative pressures were overlaid one top of another. And if there was any location consistency of bubbles, it will create a darker region as seen in the rightmost image. And we calculated these dark areas as bubble overlap or location consistency. Once we measured the bubble overlap area, we performed one-way ANOVA to see if there is any significant change in the overlap sizes among different elastic moduli hydrogels. In our elastic modulus study, when we exposed the lowest elastic modulus polyacrylamide gels to a low peak negative pressure of 18 megapascals, bubble formed at random location within the -6 dB focal area of the transducer represented by this blue ellipsoid. When we binarized and overlaid these three representative images, we see no dark region in the final overlaid image, which means bubble formation sites were not consistent for a low peak negative pressure of 18 megapascals. However, increasing the peak negative pressure from 18 to 31 megapascals for the same elastic moduli gels, we see that shock scattering is already happening at our targeted frame, and overlaying these three representative images one top of another at the right, showing at the right corner, we see shock scattering induced bubble overlap area by the darker shades of black, which means bubble formation area has become consistent at that location. On the other hand, increasing elastic modulus for the same peak negative pressure 31 megapascals reduced shock scattering induced bubble cloud formation. Overlaying of three binarized images on the bottom right corner shows increasing elastic modulus reduced bubble formation site consistency. Overall, a trend is observed with increasing elastic modulus, shock scattering induced bubble formation site consistency is reduced. Also, the average bubble overlap area for the lowest elastic modulus gels were found to be significantly larger than that of the highest elastic modulus gels. For our cavitation threshold study, first we measured the cavitation threshold for unaltered 17.5% polyacrylamide gels at around 13.2 megapascal, as shown as a red asterisk in these plots. When we added a slightly hydrophobic calcium phosphate crystals as impurities in separate polyacrylamide gels, cavitation threshold dropped from 13.2 megapascals to about 11.5 megapascals, as shown in these plots. And this shows that impurity does have some effect on cavitation threshold. However, when we added cholesterol, a more hydrophobic crystals in separate polyacrylamide gels, we see a large drop from 13.2 megapascals to about 7.3 megapascals, indicating higher the hydrophobicity of an impurity compound, the lower peak negative pressure it takes to cavitate the medium. As for the bovine serum albumin compound, when 5% BSA was added to polyacrylamide, we see a moderate drop from 13.2 megapascals for unaltered polyacrylamide to about 9.5 megapascals. And increasing BSA concentration from 5% to 10% further decreases cavitation threshold from 13.2 megapascals to about 7.5 megapascals, which indicates increasing the concentration of an angstrom size impurity can have effect on the cavitation threshold. In conclusion, we can say both elastic modulus and impurities have effect on the bubble nuclei available for acoustic cavitation in polyacrylamide gels. Increasing elastic modulus reduced bubble formation site consistency by reducing bubble nuclei available for cavitation. Also, hydrophobicity of impurities added to the cavitation medium played an important role in reducing cavitation threshold. In future, we will be evaluating bubble nuclei in biological tissues, and with that, I would like to thank our funding sources and our lab and lab members, and thank you for your time and your attention.